Hey familia, we are doing today's video a little bit differently. I'm going to be sharing my screen with you and sharing some information. Today, we're going to be talking about the 5 different fasting times and what they can do in the body to maximize healing and health. So if you're watching me over here on Instagram, then you cannot see on my screen and what I'm sharing. But if you would like the information, definitely let me know and I can send it right to you. But for those of you over here who might be on LinkedIn or Facebook, YouTube, Twitter, you can see my screen. And so I'm going to be going over these 5 different fasting times and what they can do in the body to maximize healing and health. And I can't say that enough. I can't say that any more times. I'm not feeling 100% today, but I did want to make this video and share this information with all of you. And if, like I said, if you do want a copy of it, definitely let me know and I can send it right to you. So if you are new here and maybe this is the first time that you're catching me, my name is Dr. Alex. I have a concierge healthcare and functional medicine practice, and I am on a mission to transform healthcare and how it is delivered to you. And today we're talking about intermittent fasting and some of the amazing benefits that it has. And a lot of people have tried fasting and are like, what is it even doing for my body? What's happening in my body when I'm fasting? So I wanted to really break this down and share with you some of the different fasting times and what's happening to you. What are the benefits of it? So fasting has many health benefits besides weight loss. You really give your body a break from digesting foods, and it has a very positive healing effect. And this should be really practiced as part of your daily routine. And so here are 5 different fasting times and what they do in your body and how they really maximize health and healing for you. So the first one is a 12-hour fast. And so when you begin to fast for 12 hours, your body begins to stimulate growth hormone. And growth hormone is really what keeps you looking young and beautiful and plump and juicy and really helps to preserve your muscle mass. And this is done through a process known as protein synthesis. And why I bring this up is because if you've seen somebody who has maybe lost a lot of weight very quickly, right? You can kind of tell because their faces look very kind of sunken in, their skin gets very saggy and loose. They might look very sickly and sticky and, they just don't look very healthy. So maybe they've lost the weight, but they've lost it very quickly. And so this can happen when you have a really highly caloric restrictive diet or anytime that you've just lost weight really rapidly, this can happen. And the reason why it happens is because you're not really giving your body a chance to develop that matrix and that support for your skin and for your tissues. And also, your body is hungry and it's looking for protein. And specifically when you are doing something that is very caloric restricting and you're doing like super low carb, super low calorie, all of that people try to just go all in on, right? I mean, I've been there. I've done that type of eating in the past. It's not healthy. And this is exactly why, because your body's hungry and it's going to look to your body for fuel. And the biggest thing that separates intermittent fasting from just low calorie or restrictive calories is that your body is going to turn to your muscle for the protein. Your body is going to turn to that. And you really actually are only losing muscle. So when people are losing weight, a lot of times it's just muscle mass that you're losing, water and muscle mass. And because your body's hungry. So it's going to that muscle for protein. So that's kind of the biggest difference. And so with intermittent fasting, your body is turning to your fat stores for fuel and for energy and stays away from your muscle. It helps to preserve that muscle mass a lot better. So that's kind of what happens in the 12-hour mark when you're in that 12-hour window. When you branch out into the 18-hour, that is when your body starts to go through something called autophagy. And that's just a fancy word for saying that your body is eating itself. And that sounds really gross, but it's actually so beneficial because your body starts to clean up all of those cells and that debris that is just hanging around inside of your body. And this is where a lot of the research has come into cancer and how intermittent fasting is really great for cancer treatment, for cancer therapies, how it's being used in this manner, because cancer is an overgrowth of cells. And so autophagy is eating up all the dead cells that are just hanging around, all those extra cells. And so this really helps to eliminate a lot of that extra stuff that is hanging around that can sometimes lead to cancers and sometimes stimulates the growth, the excessive growth of these cancer cells. So Autophagy is amazing. And this also goes back to something where you can take a test. I'm going to try to think about the simplest way to explain this, but you can actually be chronologically one age. I'm 40, so chronologically I'm 40, but internally the health of my organs and my cells and my blood and everything else, my tissues, might be a different age. So a lot of people who have not the best habits like smoking and alcohol and drug abuse and some other things, food abuse, that's a real thing. Their tissues and their cells, their internal age is a lot older than their chronological age. And so this is where we can get into the whole anti-aging and age reversing properties of intermittent fasting, because there is a test that you can do that can tell you chronologically how old you are versus internally how old you are. And it's possible to get older chronologically, but get younger internally. There's lots of research on this. You can go out and look it up for yourselves, but there's so much research done on this. So this is what autophagy is great at. It just helps to renew, revitalize. It's a constant process that is going on inside of you. So that's amazing. When we get into 24-hour fast, this is when we can help with our gut health, reduce inflammation, decrease hunger, cravings, better fuel efficiency, and improve cognitive function. So there's a couple things I want to talk about the 24-hour fast. And that is where you will actually start to become less hungry. And so you might notice that when you go for a longer fast, so when you go to break your fast and you go to eat that first meal, you're really not able to eat very much at all. You might only be able to eat a couple bites of food. And again, the order that you eat your foods is also very important. That's something else that I teach. But those first couple bites, and if you're really being mindful and really tuning into your body, you're going to know, hey, I'm full. And you're not going to eat anymore. And that's completely fine because your body's full. We have to start learning our body's cues again. And this just helps your body to become more sensitive to itself again. And you might not be able to eat a lot. And that's okay. It's totally fine. So that's one part of it. The other part is, there's two more parts I really want to touch on, is the improved cognitive function. So our brains thrive on ketones. That is a type of fuel that they like to use, a type of sugar specifically that they like to use, because the brain is very special. It can't use just any old thing. We've got the blood-brain barrier. We've got a lot of things that happen up here. And so our body wants the purest form of energy, which is going to be a ketone, and that's what they love. And so that's what they use for fuel. And there's been so much research done on Alzheimer's, dementia, Parkinson's, and using intermittent fasting therapy. And you can even look at the keto diet. And I said that weird, the keto diet and all of that. They're really using that as part of treatments for this, because specifically the chemicals that it produces in your body and how your brain likes to use them. So improve cognitive function. And I just was talking to a client earlier about this. You could just take it back to National Geographic and you can see that the lion, when it's hungry, is laser focused. That lion, that hyena, that tiger, whatever, they are laser focused on getting their prey because they're hella hungry. They want to eat. So they're very focused, laser focused. Then they catch that food, they eat it, then they're laying around all day because they're so full and their body's digesting it. We are no different. We are the same way. So improve your cognition, improve your focus by intermittent fasting. It's chemistry. It's what happens in your body. And the other thing I wanted to touch on about gut health and decreasing hunger and all of that and cravings is that, I did hospice nursing for many, many years, and I learned so much from hospice nursing. And one of the things I learned from hospice nursing was about food. And one of the biggest things that happened across the board, I mean, it happened with every family I had, is that when patients were dying, family members wanted to feed their loved one. They wanted to feed them. That was like the biggest number one thing. They were like, oh, mom's not eating. I gotta feed her. When their mom literally was there struggling to just breathe, and they were just worried about feeding them. And this comes back to our relationship with food. We are so focused on food is love. Love is food. I got to feed you. I love you, so I'm going to feed you. I'm going to give you this food. When in reality, in a hospice type situation where somebody is actively dying and passing away, food is the furthest thing from what you should be giving them. You are doing them more harm by trying to feed them than if you were just to leave them alone. Their body has no interest in swallowing and digesting and breaking down food. It is unbelievable, if you stop and think about it, how much energy it takes to digest food, to swallow food, to eat food, to digest it, to break it down, to pass it through your entire GI system. That's a lot of energy. When you're dying, your body is worried about keeping other parts alive, like your heart, like your lungs. It has no interest in diverting any attention to your esophagus, to your stomach, to your intestines. But we don't know that. We just equate food as love. I want to feed them. They look like they are in distress. I want to feed them. That they do not need that. You're doing them more harm than good by trying to feed them. But emotionally, that's how we feel, and that's what we want to do. And so if you carry that over into a healthy person and you think about that, our bodies are wanting to put attention on the areas that need help, that need healing. So if you're a person who has chronic pain, you've got elbow pain, knee pain, back pain, you've got inflammation, you've got all these other things going on, your body wants to pay attention to that. It doesn't want to have to worry about food. So if we're constantly feeding ourselves, our body is so focused on spending all that energy on and blood flow on our digestive system when it could be paying attention and healing so many other parts of our bodies. So why are we not doing that? Why are we trying to take pills and do a whole bunch of other shit instead of just doing the one thing that can really help us by just intermittent fasting and letting our body focus on what it wants to focus on instead of always constantly giving it food to want to eat and pay attention to? Very simple. Okay. 48-hour fasts. So 48-hour fasts are just an amped up version of your 24-hour, and it just compounds everything that you're doing. Everything that we've talked about just amps it up. And this is when we're really looking at that anti-cancer, anti-tumor growth, stimulating stem cells. That all happens in this 48-hour fast. Then we go to 72-hour fast. This is like the max. I mean, you literally can fast as long as you want, but like 72 hours is really kind of where I'm like, for most people, that's what you got to do. And this is not something that I will tell somebody to do or recommend for somebody to do if they are newer to fasting. I'm not going to be like, hey, go do a 72-hour fast. No. This is after you've gotten really good at your 18-hour fast. Maybe you've done a couple 24-hour fasts. Then I might suggest, hey, why don't you try a 72-hour fast? And fasting for 3 days is a really good practice to get into, maybe like once a month. You could do a 72-hour fast. And you could just do that for 1 week, fast your 3 days, and then just eat really well the rest of the week. Make wise choices, eat really well the rest of the week, and you will be completely fine. And then you can pick up your intermittent fasting however you want to do it the next week. So a 72-hour fast is great, but don't jump into it. This is a process. It takes time. And that's why so many people struggle with intermittent fasting that I see in all those Facebook groups and everywhere else. I tried fasting and I got a terrible headache and I'm queasy and I felt like shit and all of this. You cannot just jump into it. You got to prime your body up and then get into it and start doing it in a safe way. And so this just kind of breaks down those times and what you can work up to. And one suggestion that I have for you is if you are going to start intermittent fasting and you are looking at increasing your times, one piece of advice is leverage your sleeping time. So use the time that you sleep to intermittent fast. So count all those hours as you're sleeping. That's just really great, easy time to sneak into your fasting. The other suggestion I would make is every day that you fast, do 30 minutes longer than the next time. 30 minutes. And before you know it, you've added an extra hour, you've added an extra hour and a half, 2 hours. So that just is an easy way to progress easily as well and not just make it such a harsh jump on yourself, on your body. Okay. So these are some of the different fasting times and the health benefits to tell you what actually is going on inside of your body when you're fasting. So I really hope that you found this helpful. I'm going to switch screens here. I'm going to stop sharing and get back to the full view of me. Hey guys, so if you like this format a little bit better where I'm actually sharing with you the document, then let me know. Always open to feedback about that. And again, I'm not feeling the best today, but I definitely still wanted to make a video and share this information with you. And if you'd like a copy of what I just shared on my screen, and if you're watching on Instagram, then you can just message me directly. Just message me, and I can definitely shoot you over a copy of this information so that you can have it for yourself. But if you really want to ignite your metabolism at any age and start intermittent fasting on a regular basis and really resurrect your health, if you've got menopause or you're premenopausal, postmenopausal, you don't know if you're menopausal, if you've got chronic diseases like high blood pressure and diabetes that you want to reverse, you want to get off your medications, get off pills, get off insulin, you live a healthier, happier life, a more natural life. If you want to have more energy, you want to get it on with the lights on, whatever it might be. I am all about women's health and hormones and happiness and helping you to reverse all of those things naturally and safely. Hit me up, send me a message. My concierge service is just what you need, is just what you're looking for to help all of this become a reality for you. Stop Googling your way through it. Stop going to different Facebook groups because you know you've been in there for over a year and have not changed anything in your life or made any improvements, but you keep telling yourself you're going to. It's time to end all that. Send me a message. Get real help. Get real personalized individual help from a woman who understands, who's been in healthcare for over 2 decades. Come on. I make all these videos. You see me, you know me. You can reach out to anybody that knows me and get the full deets and get all the details about me. But reach out to me. I'm accepting new clients in my practice now, so I'd love to create a personalized plan just for you. And that's what I do. It's concierge service. It's exactly for what you need, and it's delivered how you need it to be delivered for you. Okay. All right, guys, that's all I have for today. And like I always say, for balanced life, just add spice.